All right, so we know that the quads altogether function to do knee extension. I want to point out the rectus femoris. Of the 4 quad muscles, it is the only one that its origin is on the pelvis. So the rectus femoris, its tendon crosses the hip and the knee. Let's point out one thing at a time. The rectus femoris, it's unique because its origin, its higher tendon, it comes up higher than the others. The vastus lateralis, vastus medialis, and vastus intermedius attach on the femur. So imagine the other quads attach on the femur, but the rectus femoris comes up higher and attaches on the pelvis. The only quad muscle that has a higher attachment, is the rectus femoris. Because the rectus femoris comes up higher, not only can it extend at the knee, but because the rectus femoris, its tendon comes up higher, only the rectus femoris can also help to flex the hip. So the rectus femoris has an added function, hip flexion. The rectus femoris has an added function, hip flexion, because its tendon comes up higher. All the quads extend at the knee. The only one that can also move the hip, flex the hip, is the rectus femoris. So what we can learn here is muscles have actions at the joints they cross. Muscles have actions at the joints they cross. Your quads, they all come together and their tendons go over the patella to the tibia. So because all of the quads cross the knee joint and attach below it, they can move at the knee. But the only muscle that has a tendon that crosses the hip, goes above it, is the rectus femoris. So the rectus femoris can have actions at 2 joints because its tendons cross 2 joints. Does that make sense? All right, the adductors, all you have to know is where they are, medial thigh, Suzanne Summers, baby. I feel like, Ashley, you might know, I feel like in the 80s, they had these like leotards that cut so high. Like, it couldn't have been cut any higher before we saw it off. Was it like, but it was nude pantyhose, wasn't it?
Yeah, like those big tights.
They're just high cut, man.
Yeah. It's the high rise.
This is high rise.
High rise. I'm in my 70s TV thing, so move it on up to the east side, to a dealer's apartment in the sky. No?
Yeah.
I'm moving on up to the east side. We finally got a piece. The Jeffersons, for those who don't know. All right, so the adductors are in the medial thigh. What is the function of the adductors? Hip adduction. It's in the name. They're called adductors because when they contract, they adduct. Hip adduction. Just know it as a group, hip adduction. This is a side question, won't be on the test, but have you ever wondered, why do we have such meaty thighs? In other words, why do we, think about how many muscles help to do adduction. Pectineus, adductor brevis, adductor longus, adductor magnus, gracilis. I just listed 5 muscles that do hip adduction. Why do we need so many muscles that do that? I don't know what we do in our daily lives that require much adduction.
Is it because the biggest bone?
It is around the biggest bone, but it's, give me a little bit more. So part of it is support. All of our, we have the quadriceps, we have the hamstrings, they all play a role. But in like everyday activity. So one of the main reasons and why, we don't really think about it, and this won't be on the test, every time you take a step or a stride, you do abduct a little. I have to. I can't walk exactly straight because my other leg is there. So in order to kind of bring my foot in front of the other, I do have to abduct, don't I? Also, I have to abduct a little to clear my foot on the ground. Also flex my knee. But the reason why we have the adductors is to bring our leg back. The abduction part of gait happens more with gravity. That's the easy part, but we need this every stride we take to bring me back a little. Little FYI. I know your Monday is now complete, but okay. This is a muscle that is not on your lab list to know, so you don't need to know it for lab. For lecture, just know where it is, what it does. Iliopsoas is on the anterior pelvis. It's actually a combination of 2 muscles, iliacus and psoas major. We tend to think of it as one muscle together, iliopsoas, front of the pelvis. This is our primary hip flexor. Hip flexor. Iliopsoas, hip flexor. Have you ever heard of someone straining their hip flexor? This muscle, iliopsoas, hip flexor. Hip flexion. Hip flexor, hip flexion. All right. Down the home stretch, everybody. Down home stretch. The sartorius, we know where it is, right? The sartorius in humans is that thin muscle.
The long one.
It's the longest.
Yeah.
Very good. This is extra, but it originates on the ASIS, and it comes all the way down below the knee to the medial tibia. So look at how long that is, right? This is another muscle where I'm going to ask you multiple functions, but I have a little trick for you. Just like the latissimus dorsi, I said it was the handcuff muscle. The way to think about the sartorius is to do this. It's kind of fun here. Almost like you're resting one foot on the other, like this. Cross-legged. Sitting, can you say Indian style now? What did we call it now? So when I put my leg in this position, this outlines everything that my sartorius is doing. My hip is flexed a little, hip flexion, hip abduction, right? Hip flexion, hip abduction, hip external rotation. I'm not internally rotated. Hip flexion, hip abduction, hip external rotation, and knee flexion. It's okay. We all do that, it's okay. I think maybe she inhaled something a little bit too much. Those external intercostals. Pectoralis minor. You gotta laugh. I mean, life is too. If you can't laugh. Don't you miss those days with your friends or like something is so funny and you just keep laughing? And then later you're like, why was it so funny? But it just was. So if you put your leg in this position, I can just think about it. Hip flexion, hip abduction, hip external rotation, and knee flexion. It used to be called the tailor's muscle. I guess in the old days when a tailor was taking measurements or like working, they would sit like this. All right, the gracilis we remember as like the pant seam, goes straight up and down. It does hip adduction, just like the other adductors, pretty much. All the muscles on the medial thigh do adduction. Gracilis are adductors, and the pectineus are PP, near the PP. The gracilis is also an adductor. It does other things, but I'm just picking out. Don't memorize more than you have to, right? Pectineus, hip adduction. Think about all the muscles located in the medial thigh. They all do hip adduction. Pectineus, all the adductors, and the gracilis, they all do hip adduction. With all these adductors, what is an example of an abductor? Well, one hip abductor is the tensor fasciae lata. That's the muscle high up here on the lateral side. TFL, tensor fasciae lata. It does hip abduction. Hip abduction. Tensor fasciae lata does hip abduction. I've been saying that the tensor fasciae lata has a small muscle with a long tendon, correct? Now we're naming that tendon. So the tensor fasciae lata is a small muscle. That long tendon is called the IT band. Have you heard of the IT band? Iliotibial band? Have you ever had a tight IT band? You can feel it sometimes. If it's tight, it feels like a rope. IT band, from the ilium to the tibia, IT band. Have you ever seen those foam roller stretches? Where someone like puts that foam roller and then they roll over top of it?
Mm-hmm.
That's meant to stretch out or knead out some knots in your IT band. Hamstrings. Hopefully you all have better hamstring flexibility than this gentleman. I pulled it off the internet. We know that the hamstrings are on the posterior thigh. We know what they are. The biceps femoris is the lateral hamstring muscle. The two medial hamstring muscles are the semitendinosus and semimembranosus. Semitendinosus is more on top. Semimembranosus is underneath it. We're going to keep it simple, folks. As a group, the hamstrings do knee flexion. The hamstrings do knee flexion. The origin is something I'm asking you to know for lab. The origin of the hamstring muscles is ischial tuberosity. I'm not just touching my butt for fun. I do that at home. Not in public. So just know the primary action of the hamstring is knee flexion. We're almost done, here we go. All right, let's talk about some of the lower leg muscles. We know posteriorly our calf, you know from lab hopefully. The superficial calf muscle is the gastrocnemius, has two heads, gastrocnemius. Underneath the gastrocnemius is the soleus. So underneath, if we pull this back, underneath is the soleus. Both of these, the gastrocnemius and the soleus, both of them do ankle plantar flexion. Remember, at the ankle we have different names. Plantar flexion, pointing down. You stand on your tippy toes. Plantar flexion. I mean, if you do that multiple times, where do you feel it? In your calf musculature, right? Gastrocnemius and soleus. But here's another case where one of these muscles also crosses the knee. The gastrocnemius. The gastrocnemius, you can't really tell from this picture, but its proximal tendon, its origin is on the femur. So the gastrocnemius not only crosses my ankle, but the gastrocnemius also crosses the knee. So in addition to doing ankle plantar flexion, the gastrocnemius can also assist with knee flexion. The gastrocnemius, because its one tendon comes up higher, gastrocnemius, it can also do knee flexion. Not only can it do ankle plantar flexion, it can also do knee flexion. Versus the soleus can only act at the ankle plantar flexion. Now when you admire yourself in the mirror, you can identify the muscles. The Achilles tendon, I'm not going to ask you this, but of course, I mean, I think you've all heard of that, haven't you? Gastrocnemius. It's the combined tendon of the gastrocnemius, soleus, and another muscle called the plantaris. You don't need to know it, but there it is. The tibialis anterior, that's the muscle in the lower leg on the front. Tibialis anterior, right beside the tibia. When it contracts, it does ankle dorsiflexion. So remember that the special name for bringing your toe up towards you is ankle dorsiflexion, tibialis anterior. Ankle dorsiflexion. The gastrocnemius and soleus do ankle plantar flexion. The tibialis anterior does ankle dorsiflexion. We're going to end with a little game here. I'm going to point to a muscle. Yes. I mean, you should know which is on which side. So like, she asked if you have to know all three of the hamstring muscles. Yeah, you should know like which one is lateral and which two are medial. This is my ex-husband. Joking. It would make sense. Not much that. I'm going to point to a muscle. Let's review, right? Pectoralis major, right? So you want to get in the habit of practicing pectoralis major. And then you're going to begin to memorize the functions. Horizontal abduction. Deltoid, inserts on the deltoid tuberosity. Major action is shoulder abduction. On his right side, technically the deltoid has three parts, like an anterior deltoid, middle, and posterior. So if someone is really well defined, we can actually see the sections, right? The anterior portion, see this little section? What about this one right here? Serratus anterior, what's behind it? Is it the trapezius or latissimus dorsi? This is the lats. I wouldn't ask you from the front, obviously, but this one? Rectus abdominis. External oblique. Biceps brachii. Triceps brachii. This is actually the trapezius. Trapezius. That's the sternocleidomastoid. Middle quad muscle. Rectus abdominis. Medial quad muscle. Vastus medialis. Lateral quad muscle. Vastus lateralis. The high muscle up here with the long tendon. Tensor fasciolata. Okay. He's gotta work what? Gluteus maximus. Lateral hamstring muscle. Okay, we'll get there. Lateral hamstring. He should work on his glutes. You should work on your muscle knowledge. Just joking. I'm joking. I'm joking. Biceps femoris is the lateral one. Right? So the lateral one is the biceps femoris. If this is the medial hamstring muscle, it's more superficial. Semitendinosus. This upper back muscle. Trapezius. Latissimus dorsi. All right. Let me stop this.